how is it explained in modern medicine versus in Ayurveda?
So we say sadhya and asadhya. Sadhyam is curable, asadhyam is incurable.
Can Ayurveda address these chronic issues?
Swasthasya swasya rakshanam aturasya vikar prashamanam.
How can Ayurveda explain this concept?
It can be managed but cannot be cured.
These days we know that a lot of women are suffering from PCOS issues and facial hair and all of it.
See, we cannot keep on fighting that who is better, who is not better.
Even from 2 to 3 years of age, they are into this junk food. And
Okay, who introduced biscuit? So if you have problem, I give you medicine and you are fine. How to live long, how to have a better life. With that digestive medicines, the sugar level came back to normal.
hello viewers, joining us today is Dr. Paritosh Bhatt from Kapil Ayurveda Hospital, a renowned Ayurvedic physician with a postgraduate specialization in Rasa Shastra. With 15 years of experience in clinical practice, research and education, Dr. Bhatt has held key positions at esteemed institutions like AVP and Shanta Ayurveda Hospital. He is an international faculty, speaker and mentor with the Indian Knowledge Systems Initiative by AICTE. Hello sir, good morning. Welcome to our Ayurvedic special show. Thank you so much for being here.
Thank you.
So we know that many people these days still confuse Ayurveda with home remedies. So can you please tell us what Ayurveda truly is?
See, it's not just home remedies. People are confused with various other things also. Some people think that Ayurveda is just some massage or some treatments. Some people think that it is very slow in acting. Some people think that it is just some plants or something. Some people say that Ayurveda is something like, no, it is very slow acting and it takes a lot of time. Some people think that Ayurveda medicine contains heavy metals, so all the medicines can spoil your liver and kidney. So there are a lot of misconceptions in the society. Ayurveda is basically, as a word you see, Ayur and life. Ayur means life and Veda means science or Shastram, whatever we understand. So it is actually something from life to death. Since the person is born, even from birth to death, whatever is required for a human being, Ayurveda is there for. And you'll be surprised to know that Ayurveda is not only for humans, it is also there for elephants, it is there for animals, it is there for plants, it is there for smaller animals. So Ayurveda is a complete life science which helps us to be, to remain healthy. And if we get disease, then we can treat with thing. So it has a many components.
I understand. So it's a branch of science which basically deals with all the living beings.
Yes, we can say that.
Okay.
Just to mention, you'll be surprised to know that even today there is a temple in Kerala, Guruvayur. So they have a lot of elephants. They are treated with Ayurveda.
Elephants are being treated with Ayurveda. Okay, yeah. And we see that there are various misconceptions that people have regarding Ayurveda. Like you have mentioned one point that, it's a slow treatment or it's only plant-based. So can you tell us what are some of the most common misconceptions that people have regarding Ayurveda?
In my practice, I have experienced very often two things. One is that people think that Ayurveda, the Panchakarma, the word. So Panchakarma is 5 therapies which is done to treat 3 doshas like Vata, Pitta and Kapha. So we do Vamana, which is therapeutic vomiting, Virechana, which is therapeutic cleansing or purgation, Vasti, which is similar to enema, and then some Nasyam for nose drops, as well as Rakta Mokshana, the bloodletting therapy. These are the 5 therapies. The problem is that people, if they go for a 3 days or 5 days massage, they will think that, oh, I have done Panchakarma. So the word Panchakarma is widely misunderstood in Ayurveda. Okay. And another one, what I have seen very commonly is that you take Ayurveda medicine, it does not have side effect. This is very oftenly people get confused with. And then wherever any medicine, whether it is good, bad, patented, not patented, traditional or not properly made, if it is written Ayurvedic, people start using it because they believe that the Ayurvedic word, you don't have a side effect. But it's not correct. Anything which is done wrongly, executed wrongly, consumed wrongly can have problems. For example, if you consume water in excess, your kidneys will have trouble. If you take salt in excess, you will be in trouble. You exercise excess, you will be in trouble. So anything which is done wrongly, executed wrongly will have the problem. Then, Ayurveda medicines are also same. So you have to be very careful when you consume medicines. And I strongly recommend that whenever you are looking for Ayurveda treatments, please consult a proper Ayurvedic physician and then you take the medicines.
Absolutely true, sir, because like you said, we just go by the name organic or Ayurvedic.
yes.
We assume that they do not have side effects,
Yes.
but like you said, if we take anything without a proper guidance, I think it will definitely lead to.
Yes, yes.
So thank you for that information. So these days we have, chronic conditions like stress, hormonal imbalance, and diabetes because of the, lifestyle changes or the food we consume, or, the stress that people have due to work and all that. So can Ayurveda address these chronic issues?
Yes. See, before saying that, I would like to mention that Ayurveda has a very clear-cut demarcation about the prognosis of disease. Okay. So we say sadhya and asadhya. Sadhyam is curable, asadhyam is incurable.
Okay.
Incurable also, in sadhya, that means curable, also there's two divisions. One, easily curable. So if you have problem, I give you medicine and you are fine.
Yeah.
Second is curable with difficulty. So then you may have to undergo some surgery, some therapies, or maybe treatment takes little more time to get cured. But you will get cured, but it will take some time. Third is totally difficult to cure. Means it can be managed but cannot be cured. Okay, so you may have to take some lifelong medicines, or you have to take care of things in order to remain symptom free. The disease is inside you, it doesn't go out. And the fourth category is that when totally it is incurable. So Ayurveda has a very clear demarcation of that based on the diseases where it comes. See, for example, there are certain cases which is considered chronic in other system of medicine, but it is very easily curable in Ayurveda.
Oh.
One of the very simple thing I will mention is nasal polyps.
Okay.
So nasal polyp is a very difficult condition. People keep on sneezing, they will have cold, and they undergo the surgery and everything. Ayurveda can clear it off very easily without any problem.
Okay.
I have experience of treating hundreds of patients. I'm just giving an example. So it depends on the symptoms, what we consider as acute and chronic. And I have also seen that sometimes Ayurveda helps very good with in association with other pathies of medicines. For example, I have experience of in cancer cases. So there what happens, as you mentioned about chronic diseases, in cancer cases what happens, people undergo chemotherapy.
Chemotherapy, yeah.
With chemo, people generate a lot of inflammation in the system. They cannot eat, they cannot drink. So when we give the support of Ayurveda with medicine and diet, this inflammation disappears and the person eats and they remain healthy. So we give medicines in between the chemos. Like when the chemo is there, that time we'll stop, and otherwise we'll continue. Many people are very, very comfortable taking chemo with it. So the life is, I think the future is for integrative medicine, where Ayurveda can also support in certain cases, and a lot of cases we can treat. So acute, chronic, all the cases we can manage.
But I mean, both side by side, is it recommended?
It is possible because I've been to many countries in my practice, and a lot of universities now having integrative medicine department, and they are actually working and finding that how synergistically and collectively we can help. Because the idea is to give maximum benefit to patients. Right. See, we cannot keep on fighting that who is better, who is not better. The thing is that what is the best should be given to the people. See, I am I am Ayurveda doctor. In my family, my father, daughter, they all take homeopathy. They are more comfortable with that. Sweet pills is easy.
Yeah, it's easy. Yeah.
So it depends. Whatever is suiting to you, I think that is best you should take.
So, sir, like you mentioned that, many people assume that Ayurveda takes time. So, when we are speaking about diabetes in particular, so many times people, they say that their sugar levels keep fluctuating on a daily basis and all that. So, immediately, if they have tablets, they'll take a tablet for the maintenance of their sugar levels or BP or whatever it is. But in Ayurveda, how can they manage that actually?
Okay. See, in Ayurveda, the most closest disease which we can talk is Prameha. So, Prameha is of three kinds, Vataja, Pittaja and Kafaja. We have very beautiful description where it says, Asya Sukham, Swapna Sukham, Dadini. The person who actually takes a lot of food and overeating, that means Swapna Sukham, that person is having very sedentary lifestyle, no physical activity at all. Dadhini, taking a lot of curd, taking a lot of Ikshuvikriti, means sugar cane and its byproducts like sugar, jaggery, etc. Consuming freshly harvested grains, taking a lot of aquatic meat. So all these things can precipitate and lead to Prameha. Ayurveda also tells that Prameha can also happen due to Bij dosha. Bij dosha means if your father or your grandfather, means grandparents, are having Prameha, it is all chance that the person also can get it. Okay, so this is very surprising because 2000 years before, how they know that did not use the word genetics, but the concept is the same.
Same,
right?
yeah.
So we look at like that, and we do not say diabetes and Prameha, we do not translate, but we get the symptoms and accordingly we eat it. I'll give you an example, very interesting. After COVID, a lot of people had blood sugar level increased post-prandial. Okay, so we have two kinds of blood
Yeah,
sugar
yeah,
level, no?
yeah.
Fasting and postprandial.
Postprandial.
So postprandial after 2 hours. So the person who came, a lot of people have seen that their fasting is normal, but postprandial is higher. So it doesn't make sense because one, they will increase the dose of medicine and then fasting goes down. So lot of cases I have seen, and then I realized that it is just a metabolism which is creating the problem. So I asked them to check after 4 hours. So after 4 hours it was normal. So what I did, I just gave some medicines which is digestive. Nothing to do with diabetes, nothing to do with Prameha, nothing. Just digestive medicines. So with that digestive medicines, the sugar level came back to normal. One case, just with dry dhania powder, coriander powder,
Yeah.
sugar came to normal. Can you imagine? So nowadays, everybody is agreeing, scientists also agree that diabetes is a metabolic disorder, and it's slowly becoming like a spectrum. Because when you have metabolism, then diabetes is also there, sometimes hemorrhoid is also there, sometimes blood pressure is also there, thyroid is also there. So this whole spectrum is there now. So if you correct your metabolism, I think diabetes can be managed well.
I think that people should take a note of, because not just going with the modern medicine, they can also try Ayurveda to, control their whole holistic system.
So one more thing is there, just not Ayurveda alone, along with the medications. You are taking Ayurveda, allopathy, modern medicine doesn't make, not on medicine, but you should definitely look for your lifestyle. What you eat, whether you are exercising or not, when you are sleeping, stress, all this factor is going to make a lot of difference in your sugar levels.
Nowadays, we have a concept called health, healing, and balance. So, which is becoming very vital even in modern medicine, as you said, majorly because of the lifestyle changes and the lack of exercise, which you have mentioned. So, how can Ayurveda explain this concept?
In Ayurveda, you will be seeing nowadays, previously we used to always think that there is a disease and there's a treatment. Then we started talking about prevention. Prevention is most important. Then the word came wellness. Now you will see it's very popular.
Yes.
Everywhere people are talking about wellness. And then the word came nowadays, which is coming up, is called as longevity. Okay, so how to live long, how to have a better life. So Ayurveda actually started, the books, they have a chapter called as Dirgha Jivitiyam, Ayush Kamiyam, means desire for long life, how to live a long life. So Ayurveda has a very good suggestions to prevent the disease, to have a healthy life. Okay, so we have a lot of suggestions. For example, we have a very beautiful concept called as Dinacharya. So in Dinacharya means you get up in the morning, at what time you should get up, till you sleep. How you should process your day, what you should do, what kind of food you should eat, what therapies you should do. So how you manage your day, the whole ideas are there. Similarly, we live in India, we have almost 6 seasons in most of the places, other than some coastal region and all, but in general we have 6 seasons. So Ayurveda had a concept which is called as Ritucharya. So every season what you are supposed to do. Okay. So what you should eat, what kind of lifestyle you should follow, what kind of clothes you should wear. So all these descriptions are there, which helps us to remain healthy. So you see, a lot of people will get cold, cough and other problems when there is a transition of seasons.
Yeah.
So Ayurveda gives that suggestion. So if you follow that, we don't follow it. So like this, innumerable suggestions are there, which actually can be utilized in order to remain healthy and prevent disease. I can say live disease free.
So when coming to the concept of preventive medicine, that's becoming quite a rage even in modern medicine also. So can Ayurveda also offer preventive medicine, especially we are talking about preventive medicine in cancer field, because there's a lot of buzz around it. So can we prevent a few major diseases, like you said, by following all these steps, the seasons wise and all that?
Before saying that, I will tell you, when penicillin was discovered, it was like a magic. So the scientists believe that penicillin is discovered and now no disease can affect the human being. But if you see in last possibly 50, 70 years, there are innumerable diseases which came up new. okay, where the science has no answer. The biggest example is COVID, when we had no idea what to do.
Yeah.
Okay. So the diseases you cannot avoid, it will keep coming. Why disease affects us? Because when our system is not proper. Okay. For example, if you are living in a nation where if your defenses are weak, the enemy countries can attack you. Okay. Similarly, our body is there. When our system is not proper, we will have some or other issues. So how to maintain that system? It is not by medicine. It is not by just correcting your food alone. So it has to be a comprehensive, holistic approach to it. Like you eat properly, you sleep properly, you take whenever medicine is required, you take therapies whenever it is required. You'll have a very good social life. You should have a very good emotional life, spiritual life. So nowadays, a lot of people are talking about emotional health.
Yeah, absolutely.
Mental health, emotional health.
Yeah.
It has become a very important concept.
Yeah.
So this is important, and when this whole synergy is there, then only we can call this a good thing. Ayurveda always tell swasthasya swasya rakshanam aturasya vikar prashamanam. Swasthasya swasya rakshanam means to preserve the health of the healthy, and aturasya vikar prashamanam. When the person gets some kind of disease, then we can treat it. So prevention is very, very well explained in Ayurveda.
That's very good to know, sir. And in this context, I would want to know that, these days there's quite a debate on losing weight through surgical and non-surgical procedures, because like we are talking about lifestyle changes, right? So I've read somewhere that around 75% of young generation is suffering with obesity. So, and frankly speaking, many of the people who are working in IT or all the other fields, they're so occupied with work that they are not able to give time for exercising regularly, which is quite an issue. So many of them are preferring surgical or non-surgical methods to lose weight also, and in the maintenance of body proportions, whatever we say. So even Ayurveda has certain weight loss procedures, right? So there's quite a debate going on that which is beneficial in the long run. So what would you advise?
See, obesity is considered as Maharoga. It is a very difficult and troublesome disease. Once it happens, it is very difficult to come out of it.
Absolutely,
okay?
Yeah.
Why it is happening? That is the first question. If you see certain countries like Japan, you will not find obese people, right? Similar in Africa, you won't find obese people. It's not very common. Where we find obese people is when the food is very heavy and we are not doing any physical activity. As you mentioned that IT people who they don't have time. They have time, but on an average, a normal human being spends around 2 to 4 hours on social media.
Absolutely,
right?
True, yeah.
So that 2 hours we can cut down and you can have time. If you follow the Indian concept, you need not to go to gym all the day. If you can do simply Surya Namaskar every day, that will take care of most of your stretching and physical activity needs. So at least do that. It will take some 10-15 minutes. So I always give people challenge. Okay, you do Surya Namaskara for 21 days. So when they do 21 days, they feel a lot of good changes in the body, and they continue it. So that they can definitely do. I always mention about, when you talk about youth, I always mention about evolution. Okay, so human species is supposed to evolve, but we are not evolving because of the technology. We always have support of something. If we are not exposing to the nature, like if it is hot, immediately we are getting inside air conditioner. If it is very cold, immediately we go into the heat. In rain, immediately we want to take the shade. So we are not exposing ourselves, right? And most of the times we are under the four wall, under the artificial light. So we are not exposing to sun, exposing to nature. So vitamin D deficiency is very common. Because you are not interacting with nature, the psychic is very controlled. So you always look for very comfortable situation.
Absolutely.
Four walls, your couch and your mobile. Okay. So we have to come out of it. No pathy, Ayurveda, modern Unani, any pathy can help you out of it. You have to get up from couch, keep your mobile aside, go out of the thing. So when we do that, that is the first step you can do to remain healthy, and that is my only advice to the youth.
So I think absolutely it caters to the Gen Z, millennials and everybody, because like you said, we absolutely have to find time to curb our mobile usage and all the others to exercise. So that's a very good advice, sir. And coming to the topic of rheumatoid arthritis, it's affecting a lot of people right now. So how is it explained in modern medicine versus in Ayurveda?
See, rheumatoid arthritis is an autoimmune condition. So autoimmune means when the defense mechanism of your body, instead of fighting something from outside, it started fighting you. Okay, I always give an example of a dog. If you have a dog in your house, it's supposed to bite the person who is intruding your house. But instead of that, if it started biting you,
There's
right?
something wrong.
Something like that.
Yeah.
So your defense mechanism is biting you, or it is creating problem for you. So that is what autoimmune condition is. And just not rheumatoid arthritis, we can have psoriasis, SLE, rheumatoid arthritis, many conditions are there. One thing we have to note that this does not go away. It stays in our body. Okay. But we can manage it. That is what we do. So in Ayurvedam, it can give various representations like Amavata, Vatarakta, Sandhivata, etc. But most common is Amavata. Amavata means when you have Ama, which is indigested material and which is in severe state, and it's mixed with Vayu, or Vatam. So it creates various kinds of problems. One thing is very important to note in rheumatoid arthritis in Ayurvedam is that we should not apply oil. A lot of people think that I have pain, so I'll buy some oil and apply.
Absolutely.
If they do that, the pain will increase.
Oh.
Okay. So Amavata, you have to be very, very, very careful that you don't apply oil without the suggestion of a physician.
Okay.
Never do that.
Okay.
Okay. So sometimes even if somebody is advising you oil also, your relatives or something, you should avoid. Okay. In Ayurvedam, then we say Amavatam. Amavatam is understood with 2-line sentence. We say Anga Bhanga Ruchis Trishnaha. When you have severe body pain, you have total aversion towards food, you have a lot of thirst, you have a lot of laziness, alasya, gauravam jaraha. Body you feel very, very heavy, you don't feel like getting up. Fever or feverish feeling. It's not necessarily be fever, but you always feel that I'm having fever. You may not have the fever. Apakaha shunata angana. You'll have severe indigestion. You'll feel hollowness in the body. Amavata se lakshana. These are the symptoms of Amavata.
Okay.
So any of these are happening, we can say that it is a Amavata.
That's good to know. So how is Kapil Ayurveda helping people, achieve good results in terms of rheumatoid arthritis?
See, rheumatoid arthritis, as I said, is a condition which is autoimmune, and it takes a lot of time. Okay, it depends on the situation. Suppose you don't have much symptoms, you don't have much amam, so we can give you result very quickly. Suppose it takes lot of, it is chronic, it is like for many years you are having, so it may take a lot of time to recover back. I would like to share one case with you. It's very interesting. There was a guy around 65 or 68 years of age, and he came on a wheelchair. He was referred to me by one of my very good friend who is a modern medicine physician and MD physician. So he came to me and he was like almost crying, swelling, cannot get up. So I asked him, are you okay to continue medicine for a long time? Because after some time people become restless.
Tend to, yeah.
Yeah. So he said, no, whatever you say, I will do. I said, okay, fine. So we started giving medicine. We just started giving some therapies. After 2 months, he came to my clinic walking. Okay.
That's
he had a
quite
pain.
A progress,
he had a pain, but he was walking. He continued, and after 1.5 years almost, we stopped his medicine completely, and now also he comes to my house once in a while just to say hello, not for consultation, just to say hello. He's a farmer, so he brings some things with me.
Yeah.
So now he is walking and he's completely fine without any medications, no painkillers, nothing. But what he knows is in rheumatoid arthritis, or in Ayurveda what we say Amavata, the food plays a very important role. Okay, not only food and mind. Okay, so any autoimmune conditions, food and mind is very important. So if mind has to be relaxed and food has to be perfect. If it is creating problem, you get indigestion, you take inflammatory things, you are in trouble. Okay. So he maintains that and he is absolutely fine. It does not mean that disease is cured. If he does something wrong, it may come back. But he is managing it. And he is happy without medicines.
So you have prescribed a certain diet for him?
Ayurvedam, whenever we consult, there is 3 aspects of it. Okay. We call it as Ahara, Vihara and Aushadha. Ahara means food. So we give correction in the food, whatever is required according to the situation, according to the condition. Vihara is a lifestyle, whatever is required, we'll do that. And third one is Aushadha. Aushadha has 2 components. One is medicines, which we give internally. And second is some therapies which we advise externally. So these 3 components, when it is done properly, then treatment gets complete.
That's good to know, sir. And these days we know that a lot of women are suffering from PCOS issues and facial hair and all of it, along with other gynecological issues. But I've heard from a lot of people that, in spite of taking regular medication or stuff, it's not controlled to that extent. Yes. And they're being referred for surgeries also. So how can Ayurveda help in this aspect?
In my experience, certain cases we are able to help, certain cases we are not. Well, I'm just talking about myself because there will be a lot of physicians who are able to do that. So when it is very too much of if it is very advanced, then it's little difficult. So then we have to undergo surgery. But most of the cases we are able to manage. One of the biggest reason I have seen PCOS in 12 years old girl.
Oh, it's that early.
Yes, it is that early. So there is something wrong in our food habits. Like for example, we are taking a lot of hormones, pesticides. It is there in our food. We cannot remove it out. So it is important that we should start talking about women health now, because in the competition of being modern and the challenges of the modern times, a woman faces lot of trouble. Because she is a professional who's working, she is a mother who's taking care of children, she is a homemaker, she is a wife, she is a maybe daughter-in-law. So many roles a woman is playing. So it is important to we should look for that thing, and right from the age, small age of the daughter is there, we have to take care of their reproductive health. Okay, so PCOS is basically comes from the reproductive system. So it is important that reproductive health is taken care of. If the moment you see that there is a variation in the menstruation periods, some of these problems are there, immediately it has to be taken doctor, take care of it. And I think it can be managed. But again, we don't know why it comes. Nobody knows the source of PCOS. Ayurveda has a very good answer to it, and people get very good results. But again, it depends.
So that's good to know that, women's health also is a priority, and I think people can consult for Ayurveda to, address their issues. And since we have spoken about men, women, and now coming to the topic of kids, we know that, they're into junk food a lot, noodles, biscuits, and all of it, burgers. So, like even from 2 to 3 years of age, they are into this junk food, and they're either too fat or they're lean in spite of eating. So, does Ayurveda give any preventive medicine or, corrections in terms of it, or they just have to go by managing their diet?
I get a lot of such cases in my clinic, and I always tell people who introduced this thing to the babies. I ask parents.
Parents, of course, yeah.
So they say, my child always eat biscuits. He doesn't eat anything else. Okay, who introduced biscuit?
Parents only do. Yeah.
Who introduced chips packets?
Yeah.
If you see, our society has changed. In my or your childhood, in local shops, you will see that glass bottles. It have some biscuits, some mixtures, this type of things will be there. Nowadays, that glass jars are replaced by the packets which is hanging. And you can find these packets in any remote area of the country. What happened? Why it is like this? And
even delivery is like 5 minutes, Zepto, Blinkit.
Yes. Yeah. So we have access to the packaged food. We have access to the industrialized processed food, and it is cheap. Okay, 2 rupees, 5 rupees, something is there, and the parents are comfortable. Okay, I given some 5 rupees, my child has bought something, and he's happy. He's at least not crying. Okay, so we don't go an extra mile to take an effort to make some traditional food in our house. Okay, so this has to change from the parents' perspective, where the parents should start, they themselves should start eating in home first, and that samskara we have to give to the children. There's a concept in modern medicine, modern science is called as epigenetics. Okay, so genetics is what you are having, the genome into you, and epigenetics is what you learn from your surroundings. Okay, so you can correlate with the samskara. So whatever samskara you give, the child will learn from his surroundings. If you see that parents are eating the junk food and doing things, child will learn and do that only. And then if child has a problem, then whom to blame? Okay, so we should not look for the remedy. We should look for prevention in this case, because today's child is tomorrow's citizen.
Absolutely.
So they have to always take care, give them a healthy life. As I said, I always see that there's a meme which circulates in social media where a mother is in 1980s. The mother is holding the ear of a child and asking to come inside house. And nowadays the mother is holding the ear of a child and asking go out. So what has happened? What changed?
Too much of addiction to
Too much of social media. I have seen in I think Nimhans or somewhere they are having a social media de-addiction program also now. Because the moment you take the mobile, the child will start screaming.
Absolutely.
They are so much addicted. So who gave mobile to the child?
Obviously, parents,
Yes. So I think parents have to change their attitude. I'm sorry, please don't mistake me if I
No,
say
that's
this.
absolutely
They have to
true.
change their
Yeah,
attitude,
yeah.
and they have to make things more convenient. Then things will become better. We should not blame the children. But yes, in Ayurveda, again I said ki there's no Dinacharya and Ritucharya routine can be followed in order to remain healthy.
That's a very good advice, sir. So, coming to the concept of health as an umbrella, I mean, that's just a term we use, but it has more to it.
Yes.
So, how do you justify the term holistically in Ayurveda?
Yes. In health, if you see the definition of WHO, it says health is not mere absence of disease. It is complete physical, mental, and social well-being. Okay. In Ayurveda, what we say, we use the word swastha. So usually swastha and health word is translated, but swastha word is different. Swastha, if you break down, it means swa astha, you in your own original state. See, every human being is different.
Yes.
Their mental status is different, physical status is different. So they are different. So then they in their original state. And then we say samadosha, when your vata, pitta, kapha are in balanced state. Samagni, when your digestive system, metabolism is proper. Samadhatu, when tissues are in balance. Malakriya, proper excretion, the feces is normal, urine is normal, sweating is normal. Then you'll have prasanna atmendriya manaha. You'll have happy state of your sense organs, mind and soul. Swasthite vidiyate. Such person only we call as swastha. So you may have 100%, you go to your medical checkup and you're 100% normal, all parameters are normal. Still you don't feel good. Still you don't feel healthy. What is the reason? So you don't have prasanna atmendriya manaha. You have issues with your soul, or you have issues with your mind, or you have
Mental,
issues with
yeah.
your sense organs. Ayurveda says very interesting, one more thing I just to add to this. We say hitahar vihara sevi. Person should take good, healthy food, do physical activity. Then he says samikshakari. The person should always plan before doing things. Vishveshu sakta, have the control on sense organs. Data, do charity. Samaha, treat everybody equal. Satyaparaha, speak always truth. Shamavan, forgive easily. Aptopasevi, respect elders. Bhavatya roga. Such person will be disease free. So you see that Ayurveda has a given very good concept of social, mental, physical, emotional well-being. It's not just food and activity.
We know that diabetes is an issue that is plaguing the world right now, and it's causing a lot of other health issues as well. So how do you see diabetes from the aspect of Ayurveda?
I already explained that diabetes is usually understood as prameha in Ayurveda. Prameha is 20 types, and we have vata, pitta, kapha variations. The interesting thing is that how it happens. Okay, so when we are talking here, diabetes means diabetes mellitus, where we are talking about sugar, because there is another type of diabetes, which is diabetes insipidus. So just to be sure that we are talking about diabetes mellitus and type 2 diabetes, not type 1 diabetes.
Okay.
Yeah? So here what happens is, Ayurveda says that asya sukham swapna sukham. When the person eats a lot, very nourishing kind of food, and does not do any physical activity, that means sedentary lifestyle, then consumes lot of curd, Dadhini, Gramya Aduka Anupa Mamsara Sahapayansi, consuming lot of aquatic meat, okay, consuming Ikshu Vikriti, that means anything which is made up of sugarcane itself, sugarcane juice, sugar, jaggery, anything very sweet, okay, and then consuming the freshly harvested grains. So all these things can increase kapha in the system and can cause diabetes. Prameha. They also told that prameha can happen due to bij dosha. Bij dosha means if your father or grandfather has an issue, you can also get issue. You are prone to get that condition. So though they did not use word genetics, but they had an idea that it can happen from that. Okay, so this is how the prameha is seen in our system. You would have seen that a lot of people are claiming that diabetes is reversible. Okay.
These days.
It is because the concept has changed. Previously, we always used to think that it is just the beta cells which is got damaged, so insulin is not producing, so you are having the higher sugar level. But nowadays, we understand that it is a metabolic disorder. So metabolism is a primary thing which we have to blame. Okay. So most of the cases when sugar level is slightly higher, it can be reversed just by correcting the metabolism. You can see it is very easy most of the cases. You should also understand that sugar level can also increase if there is inflammation in the system. So that is not diabetes as such. Okay. So we have to see that what is the condition, and we always first approach by correcting the metabolism completely, and then if it is required, we do certain therapies or treatments.
That's a very good point, sir. Thank you so much for being with us. This was such an enlightening talk. Thank you so much.
Thank you, ma'am. Thank you so much.